Thank you very much for that kind introduction. So you heard about depression, we heard about eating disorders, and we heard about major psychiatric illness. I'm going to talk about diabetes distress and a little bit of differentiation, how you can do with depression and major depressive diseases. So this is going to be the overview of my presentation. So what is diabetes distress? Diabetes distress is defined as a persistent emotional response characterized by extreme apprehension, discomfort, or dejection due to perceived inability in coping with the challenges and demands of living with diabetes. And diabetes care professionals must work to identify the cause or etiopathogenesis of diabetes distress and minimize its impact. For this, we need to be empathetic in our clinic. थोड़ा we have to be good listener, and we need to talk to the patients when they come to your clinic for the first time. Understanding the hidden struggles of living with diabetes is burden of self-care, interpersonal issues. I'll give you a very recent example which I faced in my clinic. A young couple came to my clinic from Jamshedpur, and the husband got diabetes recently, and they got married 3 years back. The lady very clearly asked, should I continue my life with him? I, should I continue my married life with him with diabetes? I have read so much in Google, and they say he can get all these complications, this and that. So I just come all the way from Jamshedpur to meet an expert to know whether I should continue my life with diabetes. These are the interpersonal type issues which you get in real life. Emotional worries regarding the ability to cope with illness. Relationship with caregivers and healthcare professionals also is very important. Prevalence of diabetes distress in adults and adolescents with type 1 diabetes is very, very common. They become powerless. This is the most common at the baseline. And in a study, the prevalence and 9 months incidence of elevated diabetes distress were reported as 42.1% and 54.4% respectively in type 1 diabetes. And believe me, it's more of a distress to the parents than actually the patients itself. The children who are in the age group of 4 and 5 doesn't much understand about it, but the parents are really in a big distress. And in type 2 diabetes, you find there was a 36% overall prevalence of diabetes distress noted in a meta-analysis of 55 studies in type 2 diabetes. What is important is time points in diabetes mellitus patients associated with increased levels of diabetes distress is identifiable period during which patients have the probability of high levels of distress is at the time of diagnosis. The most common is denial. मेरे को कैसे हो सकता I don't have any problems. I went for a routine checkup and I've been picked up with diabetes. They go to multiple labs to get their reports confirmed. At the time of learning how to self-manage diabetes, the moment you say, I'm not curing your diabetes, I'm giving care for your diabetes, and you need to learn how to take care of diabetes, it becomes so difficult for them. How am I going to learn at the age of 50 and 55 and 60 something new in my life? At the emergence of a complication, at the time of switching medications and healthcare plans, and at the time of switching healthcare providers as well. डॉक्टर साहब आपके पास लास्ट आया हूँ मैं 10 सालों से बहुत सारे डॉक्टर्स को दिखलाया मेरा डायबिटीज कभी कंट्रोल में नहीं आता है आपका बहुत नाम सुन के मैं बहुत दूर से आई हूँ अगर कुछ होना होगा तो इज लास्ट रिसोर्ट विच आई एम कमिंग टू यू so this is again a very big matter of distress with which we see in our clinics. Diabetes distress or clinical depression, that is major depressive disorders, how to elucidate the confusion is again very common because it's very, people feel they are very similar. But the depression or MDD is a complex and debilitating condition and frequently coexist with diabetes, which you heard. Prevalence of MDD is approximately 3 times higher in patients with type 1 than in general population, and prevalence of MDD is nearly twice higher in type 2 patients than in those without diabetes. And patients with diabetes and MDD have very poor health outcomes and high mortality rates. So this is very similar picture which we learned in the previous lecture. And is diabetes distress same as clinical depression? No, it's not the same. It's persistent over time, associated with glycemic control and disease management, and expressed in terms of magnitude and content. That is the nature of distress. So this is how you can differentiate major depressive disorders and diabetes distress. MDD is defined by presence of at least 5 of the 9 well-defined symptoms that persist for at least 2 weeks. Whereas diabetes distress is defined by the context of diabetes and its management and includes a wide range of emotional experiences. So emotional experiences may not be real symptoms or signs in those patients. They are just expressive, more of expression. It's MDD is based on patient symptoms. Diabetes distress is based on source of diabetes distress. And MDD is considered as a comorbid psychiatric disorder, whereas diabetes distress is not considered as a separate condition indicating psychopathology, forms a part of spectrum of diabetes mellitus. So there is again difference between depression and diabetes. Patient with depression have depressed mood, diminished interest, change in appetite, insomnia or hypersomnia, psychomotor agitation or retardation, fatigue, feeling of worthlessness or guilt, diminished concentration, and not to forget suicidal intent as well. And the patient with depression will usually have some warning signals as well. Doctor, I don't want to live anymore with diabetes. I don't want to take 4 or 5 tablets in a day. I mean, they will give you few warning signs which is not there in diabetics, diabetic with distress. Unmotivated, burnt out, overwhelmed, frustrated, angry, guilt, fear, and lonely. So patients are diagnosed with depression are diagnosed on the Diagnostic and Statistical Manual of Mental Disorder Criteria and Patient Health Questionnaire. And I was sharing with Shefali was sharing with me that she gives some questionnaires to her patients in the clinic when they are waiting in the OPD to fill up the forms. I think that is a very good suggestion, and that may actually help in early diagnosis of depression and mental health disorders. Diabetes distress problem areas in diabetes and diabetes distress scale. So I'm not going to talk much on screening and diagnosis because there's going to be a separate lecture for this. Just I will run through this need for development of diabetes distress scale. The 2-item diabetes distress screening scale. There are 17-item diabetes distress screening scale. So there are multiple ways where you can actually pick up your patients early in the course of disease. So these are the major sources of diabetes distress: powerlessness, especially in type 1, negative social perception, friend or family distress, physician distress, hypoglycemic distress, management distress, eating distress. And here I also wanted to include social distress, which is common in elderly today. The elderly people are just 2 more minutes, 2 more minutes. Elderly people are staying alone, children are staying somewhere else, someone in US, someone in Hyderabad or someone in Bangalore, not in staying with them. They are really very scared all the time. If something goes wrong, who is going to take care of them? So that is again a very big problem in the community today. So these are the coping skill assessment, primary investigation, 6 coping skills: negativity, acceptance, planning, blame, optimization, and action. So how do you manage? There are few interventional strategies: improve self-perception, improve coping skills, minimize the burden that needs to be coped up, involve other partners in coping up. I suggest most of my patients to keep a telephone number list of the hospitals nearby, the ambulance nearby, the physician, the doctors nearby, so that they can always be in touch with them very easily. Both the spouses, I asked them to keep the numbers very safely. So diabetes therapy by the ear, standing self-care, healthy dietary habits, being physically active, self-administration of medicines, self-monitoring of blood glucose levels. Many a times elderly people, they confuse in taking pills and injections. 7 pills in a day, 5 pills in a day, 10 pills in a day. They are in a very confused state of it time. Should give them boxes where they can be very helpful. This is the vowels A-I-O-U. Ask and assess coping skills, eliminate negative coping skills, internalize positive coping mechanisms, observe on ongoing basis, and upgrade one's understanding. So these are few minimizing discomfort or changes, breaking the changes suggested into discrete beats. So there are a lot of strategies which has been employed today to take care of diabetes related distress. And it is very important that we actually sit with the patient, talk to them, and try to take care of it. It has to be very individualized because every patient sitting in your clinic has a different coping mechanism, different resources, different funding, different uh, uh, capacity to spend money. So if you ask investigations to all your patients, which are very expensive, it may be a distress for them as well. So these are the important clinical pearls. The sudden fluctuation in HbA1c levels, major life changes, emotional reactions to negative results. These are again warning signs for diabetes distress. Help patients talk about the experience of having diabetes. Like someone will say to your in your clinic, "Doc Saab, I'm diabetic for the last 10 years." Just ask them a very simple question. What is your experience for last 10 years of diabetes? How do you feel diabetes has led in last 10 years of life? They will tell you, I was fine till 6 months back, after which I'm having all these problems. So identify specific source of their distress, normalize these feelings, help patients cope with distress. So the key messages is that diabetes distress refers to emotional response encompassing extreme apprehension and discomfort consequent to perceived inability to cope with challenges of living with diabetes. Differentiation of diabetes distress from clinical depression is crucial to implement appropriate treatment strategies, and identification of cause of distress and optimization of practical aspects of diabetes distress management contribute for overall health and well-being of the affected individual. So I thank you all for your patient listening.